I guess one thing that was very impressive for me is that I've taken some patients through some surgeries, and the longest was a 4-hour-long surgery where hypnosis was the sole anesthesia. And we talk about the concept of trance ratification, of a convincer to the patient that they were in an altered state of consciousness with glove anesthesia or with levitation or something. And I remember in that surgery, I'd prepared the patient. She'd had some trouble with anesthesia before, and so she asked if I would see if I thought she could go through surgery, and I did. And I called up her surgeon and told her what she'd like to do. And the surgeon said, okay. And I said, well, would you like to come down when I'm meeting with her and working with her to satisfy yourself by poking her with a needle or something that you feel like she can do this? And he said, no, I trust you. I thought, why would you trust me? You've never met me. I don't even know who you are. But I prepared her for several sessions. And on the morning of the surgery, I was there very early, and I had been working with her for about an hour before she was due to go into surgery. And about the time she was due to go in, they walked in and they said to me, we've had a case where some dentist from Idaho has cut off his finger or something. He's been flown down here. Our team is going to take him first. We're not sure how long this is going to take. So we're bumping you in the surgical schedule for a little while, but as soon as we're done with him, we'll take you in. So I explained this to the patient, and we had no idea. Is that going to take them, half an hour, 45 minutes, an hour? So we kind of agreed, the patient and I, that she would just continue to stay in trance. I would continue to deepen the trance some, and we would just keep her in trance. Well, it ended up being 2 more hours. So I'd been working with her for 3 hours by this time. And then we went into a 4-hour surgery. And so by the end, I've been talking relatively nonstop for 7 hours, which really kind of taxes how many deepening techniques and how many, how much dialogue you have in your system here to share. But I'll always remember in that surgery, they had a surgical drape up, and I was already feeling a little bit fatigued. I hadn't had any breakfast or anything that morning, and we were sitting there, and I was talking to her, and I decided I really needed to stretch and get a kink out, and I stood up and I looked over the surgical drape, and I thought that they were just using some betadine on her, getting her ready. They had already opened her up and started the surgery. And I can remember seeing that and seeing the blood and looking back at her face, looking very peaceful and very calm, like she was just having a lovely dream. And talk about trance ratification for us. It really impresses you with the power of the mind when you're sitting there and looking at this serenity and looking at the incision and thinking, my gosh, this stuff really does work, doesn't it? So I guess that would be one